Okay, let's get started. Hello everyone, my name is Fernanda and I'll be managing the webinar today. I want to welcome you all and thank you for registering for our webinar, From Double Shock to Double Recovery, Implications and Options for Health Financing in the Time of COVID-19. Today's webinar will run for approximately 90 minutes. It will be recorded and uploaded in our website afterwards. Before we begin, I just want to go through a couple of housekeeping items. So if you experience any difficulties, any technical issues, please let me know in the chat box, which is located in the bottom of your screen. Also, everyone on the line has been muted, except for the speakers, just in an effort to eliminate the background noise. So if you have any questions, please use the chat box. Okay, so I'll now pass it to our chair today, Manon Emerly.
Hi everyone, good morning, good afternoon, wherever you are. So I'm pleased to welcome you to this webinar today, and I will be introducing the speakers today. So we will hear first from Krzysztof Kurowski, who is the global lead for health financing at the World Bank Group. In his role, he directs knowledge initiatives to enhance the bank's support to country reform and to inform the global policy debate on financing for health. Krzysztof has advised governments at all stages of development in the design and implementation of health financing and health systems reforms. He has researched and written on health financing and systems issues and contributed to global health initiatives, among others, the Commission on Macroeconomics for Health. Prior to his career in international finance and development, he gained hands-on experience in the delivery of health services, working as a pediatrician for Doctors Without Borders, as well as the Children's Hospital at the University of Cologne in Germany. We will also hear from David Evans, who is a consultant for the Health Financing Global Solution Group. He has over 30 years of experience in health economics and financing. Then we'll hear from Irina Postolowska, who is a senior economist in the Health, Nutrition and Population Global Practice of the World Bank. Her professional and research experience focuses on the topics of health financing, service delivery, and evaluation of health systems reforms. She has joined the bank. Since joining the bank, Irina has led and contributed to lending operation and analytical work in the South Asia, Europe and Central Asia, and Middle East and North Africa regions, as well as global work on health financing. She's worked on a range of issues, including resource mobilization, strategic purchasing, and non-communicable disease prevention and management. Finally, we'll hear from Martin Schmidt, who holds a PhD in economics and works as a consultant in the Health Financing Global Solution Group. I'm also happy to introduce our discussant today. So Di McIntyre, who kindly agreed to be the discussant for today's webinar. So Di founded the Health Economics Unit at the University of Cape Town in 1990. She's based in the School of Public Health and Family Medicine in the University of Cape Town. She was the director of this unit for 13 years, the South African Research Chair in Health and Wealth for 10 years, and now she's an emeritus professor at the University of Cape Town. She has served on numerous policy committees and has extensive research, technical support and capacity development experience, both within South Africa and other parts of the African region, focusing on healthcare financing and health systems equity. She's also the executive director of the International Health Economics Association. So without further ado, I'm going to pass it on to Krzysztof, who will introduce the current report we're going to talk about today.
Okay, thanks so much, Manon. Thanks, Fernanda, for the introduction, and also to Virginia and hosting us today and diving the discussion. So that's very generous. Thanks so much. Really delighted to talk to you all today about a recent paper that we put out. And I just want to give you a little bit of background and talk a little bit about the challenges of this paper, and before I turn over to the team to present that. I think the first one is briefly on the rationale. You will recall it's just a year ago that, a little bit more than a year ago, that WHO declared the pandemic. And actually within within 3 weeks, the IMF came out with its macro forecast and predicted then the greatest recession since World War II. So it was very obvious for us to start thinking about what would be the impact of the macro changes in the macroeconomic environment on health spending, and that way the ability of the countries to respond to the pandemic. So we felt it's very important to unpack this. Now, with that, I come to the first challenge. That it was from day one, it was a race against time. So the IMF released back then at the spring meetings the first forecast, the first macroeconomic forecast in the context of the COVID-19 crisis. But given that this was all just emerging, this came hot off the press, but only for the year 2020 was the forecast, the initial forecast. The IMF had just changed the model from 18 months forecast to 5-year forecast, but now they released only the first year. And then the data came over weeks, and basically step by step they were released, both in the World Economic Outlook as well as the Fiscal Monitor, basically the two databases that we wanted to draw upon in this work. And then in June 2020, the bank came out with its global economic prospects. And by then the forecast back then was already very different, far less optimistic. So, but the problem with the two data sets is different set of countries. So the bank does it only for a much smaller group of countries. So we discussed like how we deal with this kind of uncertainty about the outlook there. Plus, at that time, the idea was also from the bank side more generally to look at the vulnerabilities of countries around a wide range of factors, and that we can make more specific and better country predictions. But that was an attempt, but that was put then on ice. That seemed far too complex. So we kept then working on this over the summer, and then just before we were close to release this report, just before the annual meetings in the fall in October 2020, but by then it was obvious that the forecast that would come out was already far less optimistic, even what the bank had released in June. So basically we decided then to say, okay, let's put this whole exercise again on ice, wait until the next data out there. So we just managed to get it out like a month before the spring meetings this year. But wanted just to say that we're currently even updating the data that are in the report based on the projections that the IMF just had put out at the spring meetings again. So again, this was a real like a race against time. The second point I wanted to highlight in terms of challenges is that we're basically going really into uncharted territory, and that really occurred to us. Dawn on us, and specifically when we looked at the policy options that countries have. So the second part of the report, where we think about what countries can do in terms of the response. The crisis is now very different. In the first place, it affects all countries. So in previous global economic crisis, we saw that often low-income countries were spared. But now the huge difference is that it originated in health. So what were the implications of this? We know we can learn a little bit from Ebola, but there were no precedents in this. But the even bigger challenge that we saw is that here in this kind of economic crisis, you saw a very strong response. So spending went up in health in year one. And then in this, what we predict is, or what the IMF predict is, that then global government spending will go down in year 2 and 3 of the crisis. So the challenge where we looked for basically on country experience was a very different scenario. What's been described so far, the literature so far looks at when countries are in the economic crisis, so when they are in recession, how do they respond? But here was the question, when they get out of the recession, growth kicks in, but then they have to cut back on government spending. How do they actually respond then? And what are the lessons learned? Let me just say one piece in terms of the literature review that we did really stands out for those who are interested. It's from Phil Musgrove in 1987, also member, or I think even founding member eventually of IHEA, who on a very thin data set basically described in 1987 based on the Latin American crisis, already all the impacts, the different impacts that such an economic crisis can have on health spending and on health. So if anybody is interested in this, it's a fantastic paper from 1987. So again, it's quite very different, uncharted territory. So we are really in a learning mode. So what we currently do is with the data that we have in this kind of report that you had a look at, we're working now with 20+ countries, working through the numbers, our projections, what they have in the budgets to reconcile this and see and basically capture what kind of policy response we see. And it's a very, very diverse picture that is emerging there. So in some great deal of uncertainty, we're learning together with the countries. So this will remain a living document, both for the reasons that we will constantly update the projections, but then also that we really have to learn about the policy response to the countries. So I stop here, and with that, I'm not sure whether there's a master of ceremony. Otherwise, I turn over to Ira to kickstart us on the macroeconomic side.
Thanks a lot, Christoph. And I see that Carmen is starting to share the presentation. Excellent. So as Christoph mentioned, the data that we'll be using for the projections in this paper come from the October 2020 IMF World Economic Outlook, as well as the Global Health Expenditure Database of the WHO, which Martin will present more on. And as we know, COVID-19 has had a double shock on health and the economy. And in this paper, we used the macroeconomic data from the IMF for the period of 2020 to 2025 to provide important context for understanding how the pandemic may affect countries' health financing needs and options in the coming years. And the projections highlight implications for economic growth and poverty, as well as government revenues and government spending. And we'll go a little bit briefly through some of the projections in these domains and their implications for health financing. So next slide, please. So COVID-19 has led to a deep global economic contraction in 2020. As we know, most countries introduced mitigation and suppression policies to save lives and prevent health systems from reaching a breaking point. Along with voluntary social distancing measures, these initiatives led to a sharp decline in local economic activity and output. And as many large economies adopted aggressive mitigation and suppression measures in early 2020, the global economy slowed, affecting all countries through subsequent declines in trade, tourism, commodity prices, foreign direct investment, and remittances. As a result, based on the October 2020 IMF World Economic Outlook projections, the estimates showed that economies contracted in per capita terms in 2020 by 6.4% on average. The projected economic impacts of the COVID-19 crisis, however, of course, are not uniform across countries and each income group, and we see some variation between low-income countries, lower middle-income countries, upper middle-income countries, and high-income countries. Not only have countries been affected differently by the virus, and their mitigation and suppression measures have varied in scope and duration, but also the country's macroeconomic fiscal starting points differed substantially. As a result, we see considerable variation in the projected changes in GDP per capita across countries, with lower income countries on average seeing declines in GDP per capita growth of about 3.7% compared to almost 8% in upper middle income countries and high income countries. A small number of countries, however, were expected to maintain positive economic growth in 2020, but at much slower growth rates than before the pandemic. And these include Bangladesh, Egypt, Vietnam, Myanmar, and China. Other countries have been hit particularly hard with GDP declines and GDP growth rate declines in per capita terms of more than 10% in 2020 and far exceeding the averages in those income groups. The October 2020 forecast predicted that the global economy would start growing again in 2021, but this growth will begin from the low base of 2020, and it will take GDP per capita until 2023 to reach pre-COVID-19 levels globally. And again, we see some variation in terms of the rebound growth rates between income groups. And as Christoph already mentioned, there is still a lot of uncertainty around the projections and how quickly countries will bounce back to their pre-pandemic economic trajectories, and the speed at which the countries will recover will depend not only on the duration and scope of restrictions and continued number of COVID-19 cases, but also the rollout of the vaccine, of course, and the change in financial conditions and commodity prices. We already see some changes between the IMF October and April 2021 projections, October 2020 and April 2021 projections, which show that the fall in GDP per capita in 2020 perhaps was less pronounced across all income groups. And some countries are expected to recover slightly more faster than they were before. So next slide, please. Due to the fall in commodity prices, reduced output, higher unemployment, lower wages, and lower consumption, government revenues have fallen even faster than GDP. In 2020, government revenues per capita, including grants, were projected to decline on average by 10.6% in all country income groups before rising again in subsequent years. Importantly, I think per capita government revenue is not expected to get back to pre-pandemic levels in low-income countries until 2022, while in upper middle income countries and high income countries, this will not occur until 2024. And in LMICs, lower middle income countries, this won't happen until 2025. Projections of government revenues follow similar patterns, and these declines will have the harshest effects in a subset of countries where the share of government revenues in GDP was relatively low to begin with. And we know a handful of countries had relatively low revenue generation capacity pre-pandemic levels, which was further exacerbated by COVID-19. Next slide, please. As Christoph also mentioned, general government expenditures were expected to be higher in 2020 than in 2019 in most countries in dollar terms and as a share of GDP. While general government revenues were expected to decline in 2020, government spending needs, of course, had to increase to mitigate the impact of COVID-19, to fund the health sector response, as well as to protect people, jobs, and businesses during the recession. In per capita terms, expenditures increased by 8.7% on average, with highest increases among low-income countries, around 6.6%, and high-income countries, 9.7%. The large increases in 2020, given the falling revenues, were financed by record levels of public debt countries have taken on, and monetary policies have also been relaxed to support the government's response, for example, with the help of quantitative easing, where central banks sometimes bought government securities on the secondary market on a large scale. With the exception of low-income countries, where the gross debt to GDP ratio will return to pre-pandemic levels by 2024. In other income groups, the debt to GDP share will remain significantly higher than in 2019. Again, we see some differences in the updated IMF April 2021 figures that suggest that the rise in expenditures is slightly less pronounced for low-income countries and lower middle-income countries, but expenditures per capita are actually not expected to decline until 2022 now, given the prolonged impact of COVID-19 in most countries. So with that context, I'll hand it over to Martin to go over some of the scenarios and implications of these figures on health spending.
So, hi everyone. I think we have the option to ask for clarifications if that is desired. Are there any questions on this? Okay, it seems there are no clarifications needed. Then I will talk about the impact on health spending of this macro fiscal context. And can I have the next slide, please? So health expenditure differs, or that not only in level, but also in composition across income groups. It consists largely of three different types of expenditures. One is from governments, one is from households, and one is from external financing. Low-income countries see their health expenditure dominated by out-of-pocket payments, and countries instead, health expenditure is dominated by government spending, sometimes financed by social health insurance, and external financing plays no role. Lower middle income and upper middle income countries lie in between. So we looked at the consequences for external financing, out-of-pocket payments, and government expenditure. And I will start with external health financing. We know least about these. External health financing at the moment stands at 14 billion and has been stagnant roughly since 2014. We have no data for 2020, and we do not know what's going to happen after that. It is possible that high-income countries will cut back on development aid, and that would mean that external health financing would also fall. IMF projects an increase for 2020 in overall health financing. External health financing is a part of that, and after that it projects that external health financing, overall health financing will decline until 2025 unless a larger share of development aid is devoted to external health financing. This would mean that external health financing would also decline. We cannot say much more about that. Out-of-pocket payments is the second source of health expenditure. We do not have data, again, that go beyond 2018, and it will probably take some time until we have data for 2020 and beyond. What we can do is to look at how out-of-pocket payments behaved in the past, and we do this by estimating an income elasticity. Typically, out-of-pocket payments fall when income, this is GDP, falls. It falls a bit less. The income elasticity is 0.88 that we estimated. And then, of course, it rises also a bit less when the GDP rises. So if we extrapolate out-of-pocket payments with the income elasticity, we find that out-of-pocket payments decline in 2020, then recover afterwards, and roughly in 2020 or 2023 reach 2019 levels. Government expenditure is crucial in many ways, and we analyzed it in various different ways. The first way that we did is analogous to the way we analyzed income elasticity, and that is we estimated out-of-pocket payments, that is we estimated income elasticity and assumed that government would respond to changes in GDP per capita equally as they did in the past. The income elasticity is estimated income elasticity is 1.3. That would imply pro-cyclical behavior. So if GDP per capita falls as it did in 2020, government health expenditures would even fall further. And that brings me to the next slide. Can we go there, please? So the pro-cyclical behavior corresponds to the first scenario that we came up with, and is essentially pro-cyclical, and we will see how that translates into projections, quantitative projections. The second scenario is important because in this specific macro-fiscal context, government expenditures rose substantially in 2020 and then are projected to contract in 2021 and 2022. And we want to know how government health expenditure responds in this context. An intuitive and plausible way to do this is to assume that governments simply keep the pre-pandemic share of health in government constant, And that means that government health expenditure tracks government expenditures. In the third scenario, which is an ambitious scenario, we look at what would happen if governments would protect pre-pandemic trends and maintain the growth of per capita health spending. And in an even more ambitious fourth scenario, we looked at what would happen when governments not only maintain the pre-pandemic growth rate of GHG per capita, but also compensate for the predicted losses in out-of-pocket payments. Can we go to the next slides? Or the next slide, please. A few short words on methods. We chose very basic methods given the large uncertainty that there is in the projections. To implement the first scenario, we just estimated the income elasticity of a GHG per capita using a log-log fixed effects panel regression, and then extrapolated GHG per capita based on the IMF GDP per capita projections. So if GDP per capita is projected to decline by 10%, that would imply a 13% decline in GHG per capita. And the second scenario, we just took the 2016-2018 average GHG to GGE ratio, which is the health share of government expenditure, kept it constant, and then extrapolated GHG per capita based on that using government expenditure projections from the IMF. That means that if government expenditure increases by 10%, GHG per capita would also increase by 10%. In the third scenario, we looked at the average growth rate of GHG per capita over the years 2009 to 2018. If that was 3%, we would assume that GHG per capita increases by 3% every year, starting in 2020. Scenario 4 corresponds to scenario 3, just that we estimated the income elasticity of OEP per capita, again using a log-log fixed effects panel regression. Then we compared the pre-COVID OEP per capita projections with the post-COVID OEP per capita projections. If there was a shortfall, we added that to GHG per capita from scenario 3. So can we go to the next slide, please? Now we look at the implications, the quantitative implications of these different scenarios. I focus on lower middle income countries in the interest of time. The patterns are fairly similar across the different income groups. What happens is that GHG per capita tracks GDP per capita as during past crises. It falls in 2020, then recovers in 2021, 2022, and reaches 2019 levels in 2023. We believe this applies mainly to countries who were not able to borrow and increase their government expenditure substantially. Next slide, please. Scenario 2 shows an increase of GHG per capita in 2020, followed by a decrease in 2021 and 2022. This is expected because government expenditures undergo consolidation in 2021 and 2022, and the government expenditure on health follows track. Again, the pattern is similar in the across different income groups. In low middle income countries, one thing that is noteworthy is that government health expenditure based on this scenario is overtaken by government health expenditure from scenario 1. Can we go to the next slide, please? What we see here is not particularly surprising. Government health expenditures in scenarios 3 and 4 are nearly always above government health expenditures that are projected in scenarios 1 and 2. Only in 2020, government health expenditure in government health expenditure in scenario 2 slightly surpasses government health expenditure in scenario 3. Can we go to the next slide? What it means is that there's a substantial gap between government health expenditure when the share of health in government spending is kept constant, and government health expenditure when government health expenditure trend pre-COVID is maintained. And this gap grows over time. What is shown here is the difference between scenario 3 and scenario 2. And we can see that this gap is getting substantial and larger over time. Can we go to the next slide? So to maintain GDP per capita trends, pre-pandemic trends, and to compensate also for shortfalls in OP per capita, governments need to give a higher priority to health, and these increases are very substantial. Instead of keeping it constant, they need to increase the share of health in government spending in 2021 by 0.8 percentage points. In low middle income countries, they start from an average of 8.4. So this is relatively a very substantial increase, and it becomes larger over the years until 2025, where the increase in percentage points would be 2.4. Incorporating also shortfalls in out-of-pocket payments leads to even larger increases in the share of health expenditure, 1.3 percentage points in 2021, and then 2.5 percentage points in 2023. In the paper, we argue that scenarios 3 and 4 is what is needed in the current context, at least for the years 2022, 2023. And David will now tell us why this is and how this can be accomplished. I think that would be it. There's again time for questions, short questions that clarify things. If there's anything, please step forward. If not, I will just hand it over to David.
Okay, thanks, Martin. Let me go to the next slide, please, Carmen. I think the next slide. That was still part of. That's it. As Christoph said, this paper, the presentation today comes from the paper that we recently published, and I'd just like to highlight here that the people presenting today are not the only ones that contributed to it. The other authors are listed there, and those of you that haven't had a chance to read the document yet, you can look at the link. The bottom line is that many of the countries, or many of the people that work in health, including health economists and health financing experts, have been saying until recently that, look, economic growth is going to start kicking in 2021, 2022. So everything's fine with health financing. We can get back on the path to universal health coverage after the blip of COVID. But what we've tried to present to you today is that that's not necessarily true. The projections are that government expenditure in general per capita is going to fall either in 2021 or 2022 in a majority of countries. If that happens at a time when countries are trying to recover, what's going to happen to health spending? The only way health spending can be maintained or increase is if the share in budgets of government budgets increase, which is going to be tough at the time that all sectors are demanding increasing shares, and the governments are trying to put their countries back on the path to recovery. So how do we do this? We argue in the paper that it's important that countries do this, in the sense that the economic recovery can't happen without the health recovery. The health getting COVID under control is a precondition for the economic recovery. The second waves that are currently going in a number of countries, but rolling out the vaccines as well requires additional health spending. So how do we do that? Next slide, please. Next slide, please. I'm not going to go through everything because here I've given the broad areas that countries can make a difference and increase the funding for health. In the second column there, it's managing uncertainty. The second one, it's making any fiscal adjustments work. And the third one, it's increasing tax revenues. Was a previous slide missed out on that? Can you just check, please? Yep. No, that one, please. Yep. On this one, the broad areas that policies are required is to increase the share is the first box, increase government spending on health, expand fiscal space, which is increasing the size of the pie, and increasing efficiency and equity of health spending. We don't have time to go through all of the particular types of policies that can work in each of these. And in fact, it's very country specific. What we're doing at the moment is working with country health financing and financing people and their external partners where that's appropriate to work through some of these projections, work through current budget plans in the countries to see which of these policies might be the most important for them. I just like to talk about, to leave enough time for discussion and to leave enough time to hear what Mac has to say about this, to focus on the top and the bottom one in the third column, just the increase of the health budgets or increase the share, which Martin showed was so important going to health. And then the final one, some of the trade-offs that come. Next slide, please. This one we've already shown you a little bit, but managing uncertainty is really critical to get the preparedness ready in case there's further waves or there's changes in the virus itself or if there's new pandemics. But where fiscal adjustments are necessary, and even where they're not, spending reviews that allow one to protect critical programs and to say which programs can give at a time or can be put on hold at a time of funding shortages, and which ones need to be protected are really important. And we also argue that there's more that we can do to try and persuade ministries of finance to give more money to health, including human capital investment as an argument in general equilibrium models, which is just starting to happen to look at the capital building and the returns to investing in health and education and general equilibrium models. The next slide, please. COVID has underscored many of the old trade-offs in health financing, and we have to get a handle on them as we move forward, even if we're successful in increasing the share of government funding going to health. There is the question in countries with health insurance about general tax financing versus wage-based or salary-based deductions. Given the crisis, the salary-based contributions have fallen. The general tax has had to step in, or reserves have been used in health insurance. But what does this mean for lower income countries planning health insurance? There's the question of central financing decisions versus local financing decisions. Local financing decisions have enabled countries to react to the crisis, but they've maybe been in federal states, it's been a bit difficult to coordinate a COVID response across independent subnational units. There's the question of funding of health services, if you like, personal, non-personal health services, against the funding of essential public health functions. This is a long-term problem. It's been argued recently that preparedness, for example, as an example of public health function, has not been funded well. And so countries are being urged, especially by external partners, to fund pandemic preparedness and response. But where does that come from? Does that mean reducing the spending on personal health care? And many low and lower middle income countries don't have enough to fund normal healthcare services. The question of funding hospital care, which has been a big part of the pandemic response, to funding primary health care. And again, many partners are saying, countries, you need to fund primary health care. But should countries actually keep excess funding in hospital, excess capacity in hospitals, just in case there's more waves? Many countries may well want to do this. These are long-standing trade-offs, but these are things that we need to take into account as we're trying to move forward post or in the recovery part from COVID. So I hope that's stimulated a little bit of discussion, and let me turn over to the chair to take over from that. Thanks a lot.
Thank you so much for all these enlightening presentations. So before I pass it on to Dai, to the discussant, I just wanted to encourage everyone to post your questions in the chat box. So we will gather all the different questions and pass it on to the speakers. So depending on the number of questions, I hope we'll be able to answer all, but yeah, I really encourage you to post your question in the chat box. So I will pass it on to Dai so that you can give us some reflections on the findings we've just heard of. Thank you very much.
On mute. The classic term of the century, I think. You're on mute. Thank you very much for inviting me to provide a few comments on the World Bank paper that's just been presented. And I wanted to start off, if I can get my PowerPoints to move on, by congratulating the team for their enormous amount of work that they've put into this report. It really contains a wealth of information. And a lot of the report is dedicated to these detailed scenarios, including in the annexes, very detailed scenarios of possibilities in terms of macroeconomic recovery and also government expenditure overall and on health. I would really encourage people to read the full report, because I think that in a presentation like this, and if you have a look at the blog post about the report, it does give the very broad brushstrokes. So you'll see statements like it will take GDP per capita until 2023 to reach the pre-COVID-19 levels globally. But there are a substantial number of countries where this is unlikely to happen until sometime after 2025. So it is important to look beyond the averages and actually look at different parts of the world, different countries, and see what is projected to happen. And in terms of the government expenditure overall and on health, while clearly government expenditure is set to decline and has been shown very clearly in the scenarios, and dangers that government expenditure on health could reduce. I found the report really encouraging, and actually to have very positive messages, particularly stressing that government spending there are policy options there are policy decisions, and providing examples during previous financial crises, but also the Ebola epidemic, how some countries have used those policy choices to sometimes increase prioritization of the health sector, and also to increase prioritization within the health sector. So there's some very, very interesting country examples of how that can be done. I also found the report very positive in terms of highlighting some of the potential benefits for the health sector of the crisis that we face at the moment. And particularly in relation to moving towards universal health coverage, particularly the focus on user fees tending to decline during this period, or lifting of user fees, and how that can be used to move towards universal coverage. And also in relation to social health insurance, where there's a very strong link between entitlements to health benefits and employment, and how that can be an obstacle to moving towards universal health coverage, and how this provides an opportunity to actually address some of that. Also because, there's so much focus on the scenarios in terms of the amount of the report, and in this presentation as well. Some of the hidden messages, and David started to touch on some of them in the last section, that I think are absolutely critical. The report gives the message that we need to push for greater prioritization of the health sector. We need to ensure that government spending on health does not decline. But the practicalities of actually how to do that, and some really important messages that I think weren't able to come out in the presentation, but are in the report, includes the ones that I've put up here, that we struggle in so many countries to persuade finance ministries that it's worth investing and allocating more resources to the health sector, and how do we actually go about doing that? The fact that it wasn't touched on much in the presentations, but that so many low-income countries and lower middle-income countries are going to be very dependent on development assistance, including debt relief, for recovery of the economy, but also the health system. And how very often in the past that has crowded out budget allocations from the general government budget, and also project funding for the health sector, and what we need to do in terms of getting those into budget lines on budget, so that this doesn't help. And David touched on the last point very briefly, that so much emphasis during the COVID pandemic has been on spending on hospitals and increasing ICU capacity. And there is a serious danger of primary healthcare, the foundations of primary healthcare and the health system capacity at the primary care level being undermined through this. And that this, primary healthcare is the most pro-poor level of the health system. And how do we ensure pro-poor health spending in future when we are out of some of the worst of the pandemic? Just to be a little bit provocative, and not to suggest that we should focus on this in the discussion, but there's some gaps, I would say, in the report, and they're quite understandable gaps from the perspective that this report has been prepared by the World Bank, and the World Bank is not in a position to raise some of these issues. But I do think that health economists should be raising some of these issues. And I remember this time last year, there was a lot of discussion about global solidarity, about how the pandemic is showing us our common humanity, and it is a time for solidarity and pulling together. And where we sit now with the most extraordinary health nationalism rearing its head, and within countries, classism. I look in South Africa and the incredible negotiations that have had to take place to ensure that those with private, who are sufficiently wealthy to have private insurance, don't benefit both in terms of diagnosing and treating COVID, but also in terms of vaccine access. And that's the context within which we are at the moment. And I think that it has implications in two particular areas. The one is vaccines, which I'll come on to just now, but also the issue of fiscal space. And the World Bank report focuses on revenue that the health sector could justifiably be seen as trying to influence. So sin taxes on tobacco and alcohol, sugar taxes, and possibly carbon taxes. And as I say, that's understandable for the World Bank to be focusing on that. But I think there is growing discussion about the issue of wealth taxes. And my sense is that if we are going to increase both the envelope, the overall amount of funds available for government spending and government spending on health, we need to seriously tackle the issue of wealth taxes, not least of all because COVID has exacerbated income and other inequalities within countries. And it also requires global efforts to promote tax compliance, whether that's in terms of multinational organizations, multinational companies, paying taxes within the country in which they have generated their income, or whether it's to deal with tax havens. And really but the other issue is that the scenarios that are presented in the report are so dependent on vaccination rates. And the report says very, very little about vaccines and vaccinations. They do mention, it does mention the potential for vaccine expenditure to displace other government health expenditure, which is a very serious issue. But in terms of the potential for there to be a double recovery, both on the health side and on the economic side, it is so incredibly dependent on the pace of vaccine rollout. So I just wanted to end with this map from the Economist Intelligence Unit, which they produced in January. And yes, we know that rich countries will get access to the vaccine earlier than others. But I think the thing that is very concerning is that there are many countries that will only have large vaccine coverage, 60 to 70% of the population in 2023. And my personal view is that this map is probably somewhat optimistic in terms of what is happening currently, in terms of some of the vaccines not being found to be as effective, particularly against some of the new variants, but also vaccine nationalism, et cetera, So I think it is very important for health economists to engage around things like vaccine prices and supply, so that it will be feasible to actually reach this goal of double recovery. Thanks very much.
Thank you very much, Dai, for your insights. I just wanted to check whether we have some immediate reactions from the speakers who would like to respond to Dai. Nope. All right. So we have one question for the speakers. Is public health spending taken into account as part of this recommendation projections?
I can maybe take that one, Manon. Yes, I mean the government health spending includes all health spending, so it includes the health accounts definition of government spending. So it's from general government revenues, but also from obligatory health insurance contributions as well. So it includes public health, essential public health functions, and personal care. There was also an earlier question from Steve about European and advanced economies, and I think Christoph's probably best placed to answer that one.
Yeah, thanks, David. Let me just quickly get back to Dai, right, before I respond to Steve's question. First of all, thanks so much, Dai. Very, very thoughtful. And as I said, that this is a living document, and we will update it over the next weeks, and we take this into account. Just on your, so very well taken points. So the hidden message, we can give more emphasis. That's very helpful. Wanted to say also that the Act A, you probably know about this global mechanism that's in place. They're jointly drafted, so WHO, Global Fund Bank, that drafted a guidance note for ministers of finance. There's currently consultation process ongoing. So what we will try to do is, based on this work that we present today, plus that guidance note for ministers of finance, that we want to basically come up with some very strong message platform for the institutions, so most multilateral institutions, on health financing in time of COVID-19. So we will take this into account in terms of the hidden message that you highlighted. Just quickly on the more provocative comments that you raised. I think on the, let me take them not in the order that you raised them, but the first one is on fiscal space. It's difficult for us to write about this in the health department, right? This is an effort that basically pertains then more to we call MTI, so different departments, the economic, the fiscal group. But what I wanted to say is we wrote actually a piece together with them that was just shared with the ministers of finance at the spring meetings. So will come out now in May, where we didn't look at the sector specifically, but we looked at human capital. And in this context, we talk also about wealth tax compliance, so we can tackle this in a much broader way. So we will address this. What I thought, what you would have raised is the whole question about debt relief. I think that's where we're pretty much stuck. Now there's the debt service suspension initiative ongoing, just extended at the spring meetings at the end of the calendar year. The problem with this is in net terms is equal, right? So this is simply a suspension, and the countries will have to pay back the suspended payments with interest in the future. So this is only a liquidity problem. It's not a debt problem that we have addressed so far. The problem with the debt situation right now is that it's so difficult compared to earlier times, is that most of the debt that countries have is now in the private sector, the private capital market. So to come up with a coordinated effort on debt relief is extremely difficult. And actually the risk right now is that if the bilaterals and multilaterals will coordinate an effort there, that could eventually result in a downgrading of the credit ratings for the countries, given that they have large debt in the private sector, and could limit their access to private capital. So there's a fairly complex situation on debt, and I think personally, I think this is where we have to do much more. Now 6 countries already defaulted, debt service ratios are unsustainable. Many more countries go in debt stress, and that is the next threat out there. There's a debt crisis for poor countries. So On the global solidarity, in particular about vaccination, this is something, when we started writing this, we didn't even know that there's a vaccine, right? And by now it's an extremely complex issue. And we will think about this. At least the bank is very forceful in terms of its statement. There must be universal vaccination as quickly as possible. We are part of the supporting COVAX. We tried to mobilize as quickly with some limitations funding for countries to support the initiative. But there's more to come on vaccination. That was a request we had also internally to say something on vaccination. So we'll address this. So again, Dai, fantastic comments, and we're on the same page there. Now, quickly on Steve, he asked whether it's too much doom and gloom, in particular from a high-income country perspective. Agree with this. In particular, if you look at the projections that just came out at the spring meetings, high-income countries look much better. Again, our work was more focused on the projections from the fall. I just want to highlight there one thing, right? So the entire upgrade on the global outlook, on the global economy, is simply driven by the United States, right? This is the country the first one that will recover to pre-COVID level in 2021 with its rapid growth, plus of course China and this. But the risk is when you then look at these kind of global averages, that's our concern, that they mask what's happening in low and lower middle income countries. And that's really the focus of our paper. So we really want to give attention to this. But again, we will update this. As I said, the data are from the fall right now on the macro. We will update this right now. And that will show that the situation in high income countries is much better than anticipated. But again, driven by a few. Back to you, Manon.
Thank you very much. We just had one question coming up now, so I'm reading it at the same time as you, I guess. So what context, has there been any analysis on the contextual factors that may affect projections? And second question, I wonder, was your thinking on building capacity in country to improve in-country decision making?
Thanks so much, Manon. I'm still trying to digest the comments. David or Martin, can you take the first one from Jacobo? And I can talk a little bit to the second one.
I guess I'm thinking maybe we can people who are willing to ask questions can unmute themselves. I'm not sure, Fernanda, whether this is possible, so that people who are willing to ask questions can speak up. I think that's going to be easier.
Yeah, I can speak if that helps.
Yeah.
Sorry, no, there are just two comments that are related to context. So the first one is that I know that in GHD there's data on some of the contextual factors that may affect the projections. So for example, the percentage of total health expenditure that goes through SHI or government financing that is available from GHD, or informal sector size that is available from ILO. So I was just wondering whether there was some analysis on these contextual factors, because we know that each country has a different context that that was mentioned many times, and that makes a lot of sense. The second piece is that because each country has a different context, then in-country decision-making could be improved if the capacity within these countries is expanded in health financing and health economics. I know that there's a lot of work on human resources for health, specifically expanding, for example, the production of doctors and nurses, which makes a lot of sense. And I was wondering whether there was thinking on expanding capacity of countries in health economics too. Obviously, this is a longer term type of point, but it could be relevant, and something that I see that is coming up. I'm working now in Sierra Leone, and there was some thinking on that. I know that there's the first MSc in health economics that is starting in West Africa. So I was thinking whether these are things that would make sense in expansion of human resources for health programs.
Let me quickly take the first one, if that's okay with Martin and everyone else. A good point that obviously the contextual factors in each country determines the extent of the downturn, the extent of the increase in health financing in 2020 and what's likely to happen thereafter. We haven't tried to model that because the purpose of the modeling is simply to say, hang on a bit, you know, even with recovery, there's a problem with health financing, and then what can we do about it? And so what we're doing that is to try and take the contextual factors in one-on-one conversations or group conversations with a group of countries and say, well, what's your situation? What's your situation in terms of the downturn, in terms of the likely macroeconomic forecasts now, in terms of your debt levels, in terms of your capacity to sustain the debt, and then in terms of your health financing, how is it done? Do you have health insurance, and what can you do? So we're taking it more qualitatively into the policy discussions and using the numbers as the entry point to the policy discussions. So let me turn over to whoever is at. Christoph will talk about the capacity building.
Yeah, thanks, David. Yeah, just just to add to David's point, I think we discussed this, whether we can have more precision in the projections, but as David says, for the engagement of the countries, this is sufficient. Then we have to really work country by country on this agenda. But also the other reason is simply there's so much uncertainty in the macro projections that the real change that we see in the data comes from there. And given the level of uncertainty, it doesn't make too much sense to work on getting these projections more specific when they're driven by the macro environment. Quickly on the capacity side, yeah. So in general, this is the way the bank works is at the country level. It's basically driven by country demand. So it's a question whether countries demand support from the bank on capacity environment in those fields. That's one of the limitations there. But what we try to address it is through regional initiatives. So the first one is on Africa specifically. So we're working on the African Union under the African leadership meeting, the resolutions that they passed, and there was one to develop a tracker complementing the scorecard, but now thinking about knowledge hubs on health financing throughout the regions. And we're just discussing this internally, currently, how we best support this. I think there's at least some controversial issues that need to be resolved in terms of how we can make this bottom up rather than a top down approach through the regions in the Africa regions. That was the original AU proposed model, but we're working on this with the African Union right now to beef up this capacity. Thanks.
Thank you for the answer.
Thank you. I can see one question from Deliana. Would you like to speak up, or maybe I can read your questions?
Oh, either way is fine. You can read it.
Right. Okay. So issues surrounding spending for pandemic preparedness were mentioned. What are your thoughts about argument that preparedness funding is not mutually exclusive to, say, primary care funding, given the strong link between COVID severity and underlying chronic diseases?
And if it helps to clarify the question, essentially what I heard earlier was there is difficulty sometimes communicating with ministers of health about the case for allocating funds for particular purposes. And so that's probably especially difficult for pandemic preparedness. But I'm just curious to see about communicating the message that that sort of funding is is essentially part of broader funding for health strengthening in countries, primary care included. And that's because of these strong links between chronic diseases that already exist in the population and the severity of COVID outcomes. Or is, just curious to hear your thoughts, not one way or another.
Yeah, thanks, Liliana. You raise actually a few issues there that we don't have the answers to when we're working on. So the first one is the challenge that you want to get out of this cycle of panic and neglect when it comes to preparedness financing. So fully agree with this. The bank is fully on board on this and supports countries in this. The question now is first, what's the approach to that? Because the international approach to preparedness is the joint external evaluation under the international health regulations, and this is a let's say fairly complex framework that's used, right, with 19 different dimensions. And if you want to fund this, the estimates vary pretty much, but just to give you a sense of this, so what we estimated is that the core of the JEE is between 50 cents per $2 per capita, but WHO has other estimates there for the full package of JEE is $30 per capita. So when you think about in particular low and middle income countries with their current spending with prepaid and pooled funding, you just wonder where's the funding coming from, right? So that's the tension. Will this come from money that's normally spent on health services? Do you take it from there? Where is it coming from? And again, what's the approach to this? How ambitious do you want to be about this? And as David said before, and Dai highlighted also, where we have that tension right now between hospital care, investment in hospital care. And it's not only the investment that is problematic, but is that the investment in hospital and ICU beds triggers recurrent expenditures in the medium term and in the long term. So that has the risk of channeling funds away from PHC, which has to be part of a solution to health security. You know, we know how central PHC is to health security, in particular in the first response to outbreaks to contain them. So the question is, how do you reconcile this? How we try to address this now with the countries. Maybe just one point to mention: we are updating our guidelines on public expenditure reviews to address exactly those questions. So the first step is, and I think that's part of the problem we're facing right now in the country dialogue, that many countries still don't know yet how their spending looked like in 2020 in the response. So that the idea is with public expenditure reviews, updated guidelines for country by country, look at how actually the spending shifted in 2020. We're still not, we don't have a really good picture there. And then take it from there into the conversation in the context of, as David said, in the context of fiscal adjustment, what to come, what to protect, and then take it from there. So that's the approach to this, but it's fairly complex. There are no straight answers to this, how to reconcile this. It has to be country by country.
Right. Yeah, that makes sense. Yeah, to me, it seems that probably the main difficulty, or maybe the main cause for this dichotomy between the spending for different purposes is that the IHR has now, it's completely focused on specific items which don't include primary care aspects much. And so there's almost a competition that may not be necessarily optimal in some cases. Yeah.
I think the other problem, Liliana, you have right now is that also the JE, the external evaluation, when you look at the results of the evaluations, they didn't respond pretty much with actually the ability of countries to respond to the crisis. So there's also a question right now how to, I mean, JE wasn't designed for this. Look pretty much at the capacity of countries, but not the capability and the ability actually to respond. But as you know, the countries that came on top of the JEE evaluations are the US and the UK, and we can say that they handled this situation well. So that's the other problem that we're facing. So a lot of thinking has to happen on what do we mean by health security, what are the priorities, in particular in resource-constrained environments, what are the first steps that we need to take?
Mhm. Yeah, thank you very much. Very interesting.
Sure.
Do we have any more questions from the audience? Feel free to unmute yourself and ask your question if you have. If not, I'm just going to ask the World Bank team, do you have any closing remarks that you would like to make, or Dai, or if you have anything else to add?
Perhaps just a few words, and thanks a lot for this opportunity and wonderful discussion to present also our paper and findings with you. I think just going back to some of Dai's points as well, and excellent remarks. I think in terms of vaccination, certainly this is a key component, as Christoph mentioned, also that will be included in the further revisions of the paper. And we are engaging with countries to support procurement and deployment of vaccines. And in many of these countries, they actually see vaccines not just as a health intervention, and so perhaps it won't be directly taken out of the health spending budget, but also as an economic stimulus given the repercussions on the economy and the labor force and so on. But I think it's important also to highlight that, of course, we focus on these macroeconomic indicators and the implications on health spending, but we should also remember that the pandemic is expected to reverse progress made in poverty reduction across the past decades. And here we also see particular impact on the poor, the vulnerable, the youth, women, and informally employed. So making sure that systems, and again, especially those relying on social health insurance or payroll tax-based contributions, to ensure that there's broader coverage and more pooling to ensure adequate access to health services in the future. I think also from the World Bank's perspective, given that we've engaged with countries and particularly with ministries of health and ministries of finance. In these discussions, we do see some positive movements in terms of the ministries of finance openness to discuss health systems issues more broadly, given the inherent challenges that they've also seen with the COVID-19 response that require more long-term and medium-term to long-term reforms in the health system. Certainly, these discussions, at least now, focus on the immediate impact of COVID-19, but we hope that this also opens the door to more long-term engagement and discussions around the health reforms and multi-sectoral reforms that are also needed to improve health outcomes and ensure financial protection. So thanks again.
Thank you very much, Irina. If we don't have any more comments or questions, maybe Christoph wants to say something.
Yeah, maybe just want to check in with Martin, David, whether they want to add anything.
Not from me, thanks. Just thanks to Manon and Dai and everyone that I hear.
Yeah, same from my side. I enjoyed that. Thanks to everyone.
Yeah, same from me. Also, big thanks. And I just want to highlight, if there's one tagline we had for the report, it's that the worst may be yet to come for countries in terms of health financing. So we stay tuned, and we will keep you updated on the thinking on the bank on this side. Thanks so much again.
Thank you very much. Well, it's my turn to thank you on behalf of the Health Financing Special Interest Group. And I can see that in the chat box, Carmen has put the link to the report if anyone is interested. And in any case, this webinar will be on the IKEA website, so you can encourage others to have a look at the presentation from today. Thank you very much. And I don't know if Fernanda, if you want to say a last word, but for me, bye for now.
Yeah, so just remember that it has been recorded and uploaded to the website. And thank you all for coming. Thank you to the speakers for coming and discussing the paper. And have a good day.
Thank you. Bye-bye.
Bye, everyone.
Bye.
Bye-bye.